So why general practice and a centre in the East End of London? 90% of people go through their general practice every year. Now, isn't that a fantastic opportunity? We see waits in the NHS as a problem. I see it as an opportunity. What else could you do at the same time? When I started as a doctor, it was all about science and evidence. I soon learned that actually what we do in the health service is only 30% of health and well-being. The other 70% you're going to see in a few moments. It is people's employment, it's their education, it's their environment, and it's their creativity. And that's what the Bromley-by-Bow Centre is all about. And the final thing I'd say to you is, 10 years ago, I was at BMA House when the bus bomb went off, and I sat down and thought that evening, having dealt with all those casualties, what our other task was. And uniquely, you will see in the pictures at the centre all different communities mixing together without realising they're doing it. I came back that evening and thought, what is it that can make somebody so dehumanise their neighbours that they can bomb them? And actually, how could we change that? So this centre is about health in its wider sense. It's about well-being. It's about bringing communities together. And let's take you round. So first of all, let's just talk a bit about the environment in Tower Hamlets. This is Mile End Road, known as Chicken Shop Mile. There are 5 chicken shops here. There are 42 chicken shops per secondary school in Tower Hamlets. That's the problem we face. And I jest not when I tell you that McDonald's is the healthy end of the market and is what I recommend to my patients. But this is the Bromley-by-Bow Centre. So 15 years ago, actually, this was a typical inner city park, and my East End patients called it dog shit green. You'll recognise those parks throughout London. What we did was build on it. It was the first thing we did. And on the right there, you'll see the health centre. In the middle, there's a cafe, there's community care, there's a connect zone, there's various art studios, and on the left is the social enterprise barn. We set up something like 60 social enterprises, 10 have failed. That's a fantastic success. So you already get the sense of a general practice and a community centre, over 100 different projects under the roof. And of course, this is the entrance to the health centre. Notice no NHS signs. There was a lovely moment when one of the health ministers, a very gruff health minister, came to see us and said to me, Sam, they were into badging NHS then. I said, why would I want that? This belongs to the centre. And then he came into the yard and he said, actually, there's no signs telling people where to go. And I cheekily looked at him and I said, yes, that's because we encourage our guests to get lost. He took a double take, as you can imagine. And then I explained to him that what happens when people come into a centre like this, with lots of different entrances, is people say, I'm lost, can you help me? Or they say, somebody who works there or is involved in the centre saying, you look lost, can I help you? And I would argue, actually, that every hospital in the country should take away all its signs and ensure that all the patients got lost within the building, because the health and well-being that would come from that would be quite staggering. Bromley-by-Bow, you might say, well, how do we badge or label ourselves? Is it we're a great general practice, it's about health outcomes? No, it's 4 things. It's about compassion, it's about friendship, it's about having fun, and it's about assuming it's possible. And that's what we're all about, and that's what all health and well-being is about. So you come into this fantastic yard. By the way, that arch is an example of partnership with the private sector. Tesco's gave us 20,000 to put that up. Very nice, very generous donation. And then we said to them, what can we do to help you? And of course, what they didn't have was a lot of Bangladeshi clients actually in their supermarket, and we taught them actually what sort of foods they needed to have in their shop, how they present them. And guess what? My bet is that we probably made them a lot more than 20,000. The point of this is about partnership, and it's about partnership with everyone. And then it's about sharing space. So this is one of our projects called The Young at Art. I talked about creativity and spirituality as a key part of the planks of what we do around health and well-being. And this is an elderly group producing fantastic art, and as I say, calling themselves Young at Art, which kind of says it all, doesn't it? And then you come into the waiting room, and it's an art gallery because we've got a lot of artists in our centre. And on the right there, you'll see the housing officer. So I live in the local housing estate, and I come to that housing officer if there's anything that goes wrong, the plumbing or the lighting or anything else. That is critical. A friend of mine in Leicester, as a GP, has got a police station in her waiting room. Little blue light above their door. And if you meet the coppers there, they'll tell you two things. Firstly, they're liked by the community. That's a new experience for them. Secondly, their bosses think they're fantastic because they've reduced the crime rate on the local housing estate to 20% of what it was before. That housing estate had buildings being boarded up. Now it's got a queue waiting for people to come there. And a very simple example of putting, sadly, the police distrusted in a lot of these inner city communities with the most trusted professional. And guess what? We have politicians' surgeries there too. And it's about also how you behave as an individual. You know, I've never used my doctor title at all. I'm Sam to all my patients. I am, I admit, a natural scruff, but I've never worn a tie in years. I go out to the waiting room. It's, hi, Jane, how are you? This is the consulting room. Notice it's slightly different. We sit next to patients. It's about a partnership with patients, which is critical. We know that if you're to get the best health gains at the end of the day, it's about partnership. Yes, there are moments where you need to be quite directive to patients. They're scared. They want to get a sense that you're going to sort their problem out. But most of the time, it's about a partnership with patients. Most importantly, it's not about what is the matter with a patient. It's what matters to patients. That's really important. A subtle change of words, but absolutely critical. So we have all sorts of people who work here. Now, this is Yvonne, who's our nurse artist. So we employ a nurse artist. And she does these courses and produces fantastic art. And these are primary school children. By the way, that's the internal airways of the lung, and the colours represent the different colour inhalers. But a 10-year-old at the end of this course coming into me and saying, Sam, my peak flow's gone down 50, I need a step up in my treatment, please prescribe me this. And why shouldn't that happen? And actually, fundamentally, with kids with chronic illness, it's very easy. They're not nearly as squeamish as adults. You can show them bits of lung, anything you like, and actually they absolutely love and engage with it. And of course, you get much better outcomes. We gave an awards ceremony at their local school, and of course, in the East End of London, kid with asthma, a bit wheezy, a bit weak, not as strong as the other kids. Actually, suddenly you found other kids turning around and saying, we're missing out on something here. It's a bit of fun we've missed out on. Actually, maybe we should have had asthma. And of course, education is quite critical. So English as a second language, absolutely vital. In our community, probably about a third do not have English as their first language. That's a massive health and well-being disadvantage in our society. A community cafe we have there with fantastic food, and we all sit down and eat together. Is that a problem? It's quite interesting, isn't it? You go to most hospitals and areas, and you'll see people eating in separate areas. You're eating there, nobody will know whether you're a patient, doctor, nurse, whatever. And of course, we're a community university. I said earlier on, any education you give to anyone will improve their health. Give them a job, you'll improve their health. I remember a patient saying to me years ago in the early days as a GP, when I thought I was being very clever and suggesting I refer them to a social worker, and they said to me, Sam, I don't need an effing social worker, I need a social worker's wage. And wasn't that a good lesson for me? And of course, we do things in very different ways. Diabetes, okay, so I can sit there and prescribe a drug, but actually, wouldn't it be more fun and better if we manage and treat the whole family? So we invite the whole family to a diabetic fair, produce wonderful food, a tombola, ready, steady, cook competition, and at the end of the day, and opticians and everyone like that, but at the end of the day, actually treating the whole family. Just to give you an idea of partnership, we run an antenatal and child health clinic at the same time with a raft of other people on hand to actually help people. Simple integration, isn't it? Most places you go to, they'll separate them so that as a pregnant woman, you won't meet the health visitor until 10 days after the birth of your child. Why don't you do it together? And actually, if an artist comes to you and says, actually, I need some models, why not say, as we always say, yes? And actually, the reason she came, because of course, you imagine the East End, we have the world in the East End in terms of models, and produces beautiful paintings like this. Foolishly, just before she left, I said to her, would she paint my 2 children? And this was the mistake. I said I'd pay her the commercial rate, at which point she looked at me in the eyes and she said, Sam, that will be £20,000. I've just been commissioned to paint the Queen of Denmark. What happens is if you open up your mind to saying yes, if you open up your mind to sharing space, it's amazing what happens. And I can't tell you what will happen at Bromley-by-Bow tomorrow, and that's part of the fun of being part of this whole process. And of course, this all started with the church. So here you have a vicar, new vicar comes 30 years ago, he's now in the House of Lords, Lord Mawson, and he says to his elderly congregation, who are diminishing in numbers, he said to them and the community, what can we do that's different? What is it that the community needs? And what the community said was, we need a nursery. And in fact, my eldest child, now who's 24, is a doctor. He came to this nursery until the age of 14. He's not a late developer, but we had a holiday club, an after-school club. The point was a completely mixed nursery. And a very unusual church. I remember when my wife, when we had my first child christened, my wife, who was not Christian at all, looked at Andrew and said, as she did, very directive, and she said, Sam, as she said, Andrew, I've got a problem, I don't believe in God. Andrew looked at her straight in the face, says, that's not a problem, now what do you want in the service? That tells you quite a lot, doesn't it, about the ethos of the place. It's about accepting people as they are and actually making them part of the whole centre. And he would say, if he was asked what his congregation was now, not the 10 or 20 people who are there on a Sunday, but actually the 4,000 people who come through the centre every week. And finally, this is the park. This is the park which we, as a charity and a centre, manage. We've got a 30-year contract and have converted it into something that was dog shit green, into a beautiful, healthy space. And if you come in there, particularly on a nice day, you'll see lots of young people, lots of elderly people. Where do you see that in a park in London? Where can an elderly person walk through a park and feel they're safe? But most of all, this is about what I said Bromley-by-Bow was about. Being compassionate, being a friend, having fun, and most of all, assuming it's possible.